All right, great. Thanks, Tina. And yeah, welcome everybody to the final Pocket Talk of the year. Thanks for joining. Looks like my screen is sharing. So I'm just going to spend the next 23 minutes talking about this, preventing dementia, and really, answering the question, how do I, advise my patients in ways to optimize their brain health? Um, so I'm going to try to focus on, sort of giving you the advice and language that you can then in turn give to your patients, and or actually avenues where they can reach out for more help from us, for instance. So really, this is a question that we hear a lot from patients. I want to keep my brain healthy. What can I do? So how do we answer that in terms of lifestyle? And so I will say, start with this, that we, the KU ADRC, we want to help you answer that question and help you with your dementia patients as well. So we're looking for ways to help. We want feedback, advice, questions, and we're working hard to invent ways to help you. And so a few of the things we've invented are the My Alliance program, which is something they can sign up for. And it's basically comes down to a weekly email with links and invitations to lots of things that we're doing. And then our LEAP program, our Lifestyle Empowerment for Alzheimer's Prevention program, which is really a program we've been working on for really the last 8, 9 years, and growing it. And it is all about answering this question: what can I do to keep my brain healthy? So these things are all, including Pocket Talks, are all ways that we're trying to find to and invent to help you do your job and help us do our job as neurologists and clinicians and researchers. So I want to start with that. And here also our LEAP courses for in the coming months. These are things you can offer your patients. They can look us up, search for LEAP, or go to the KU Alzheimer's Disease Research Center website, or go to this website, kubrainhealth.org/LEAP, and get signed up. You can see we have 3 courses coming up, 2 online and 1 in person. We're doing things like the Brain Health Boot Camp, which kind of covers everything, or the Mediterranean Diet course. These are really popular courses. We're getting hundreds of signups. And then the Mediterranean Diet course, which we're going to do in person in October. And we have other resources, a blueprint, Brain Power Blueprint book. We have a booklet that's about 20 pages, simple steps to a healthier brain. Got a brain healthy lifestyle score, and then we do lots of standalone webinars. And if people sign up for the My Alliance program, then they'll be connected to these opportunities. So okay, but let's get to it. Here is a figure that I love to show because it is what has happened in terms of cardiovascular deaths from 1950 to 2010, and bending the curve of cardiovascular deaths over these years. You see this long and sustained decline in deaths. And then a lot of the reasons why this has happened around that line, and beginning with understanding risk factors for the disease, and then the over the course of time, different drugs developed, different technologies developed, and then work on reducing those risk factors, things like blood pressure and cholesterol, bringing all that to bear on this one problem of how do we reduce cardiovascular deaths. And the reason I like this is that I think we are in a parallel, we're probably 50 years behind cardiology at this point. We're kind of sitting where they were sitting in the 70s in terms of dementia and dementia prevention. We're just beginning to bend the curve, and we're just beginning to understand how to bend this curve in terms of dementia prevention. And so, but what is it going to take? It's going to take everything. It's going to take lifestyle. It's going to take drugs. It's going to take technology, and it's going to take different types of care and healthcare systems and healthcare models of care that are new, et cetera. And it's an exciting time because we are really in a transformative time for Alzheimer's and dementia research and care now, with new diagnostics and new therapies. And so, and as I'll show you at the end, we have data that suggests we are already just beginning to bend the curve in terms of dementia incidence. So I'll start with this. This just came out as sort of a renewal of the Dementia Prevention, Intervention and Care report from the Lancet Commission just a few months ago. It was updated from 2020. Makes the point of that there are risk factors that are that we can do something about, such as the figure on the right showing 14 different risk factors, modifiable risk factors that are related to dementia, and that if we can work at reducing these, we may be able to prevent or delay up to 45% of the world's dementia. And these risk factors are sort of spread over life. This figure on the right follows the life course in early life, midlife, and late life, and kind of where these risk factors play their biggest role. But I guess the point here is there's a lot of data, a lot of evidence that these things are linked to dementia, and it really is time to, and in their words, be ambitious about prevention. We need to be ambitious at the individual level, and we probably need to be more ambitious at the policy level. How do we, at the population level, leverage what we know about these risk factors and what we can do to prevent them, to then in turn reduce the risk of dementia for individuals and across the population. And so I'll talk a little bit more about this and our advice we give, but I'll make the point again here that it is time to get started on this. It's time to be ambitious and start moving these things into care as much as we can. Now we've got to develop new ways to deliver that kind of care, to as physicians or clinicians, to create tools so that we can get patients reducing these risk factors, and that's on us. But at the same time, we can be more aggressive about these messages and trying to develop tools that are going to translate these findings into action. And so this was written in 2021, that it's time basically for brain health and what we're learning about brain health to become incorporated into the primary care agenda. So but let's talk a little bit about the specifics. So first, the Alzheimer's Disease Research Center, we're one of 33. Actually, we just added 2 more sites, 35 nationally designated Alzheimer's research centers. What does it mean to have one of these? It's really hard to get and to break into this club. We broke in 2011, so we've been at it for 14 years, 13 years. And we're up for renewal next year, and every 5 years we get renewed. So we've had a lot of success. We've had a lot of growth. And what it means is we've got a lot of educational programs. We've got clinical care. And most importantly, for these programs, we have research that's really moving the field forward in a lot of different ways, and bringing some sort of really interesting new stuff into that network of Alzheimer's disease research centers. One of the things that we've done really well is, compared to other sites and centers, or where we're leading, is in this idea of, is exercise good for the brain? And is it something we can use in the fight against Alzheimer's? And we've done a series of studies over the last 15 years trying to understand this better. And we believe we've shown, although we're still working at this, we need a lot more data to really prove a lot of key questions. But despite what you read in the newspaper, like New York Times, that covered 2 of our studies, in 2015 and one in 2017. But and through these studies, we believe we're gathering evidence that really does show that exercise has brain benefits. It's modest, but it doesn't take a whole lot to get those benefits, and that it might slow the changes that we see with Alzheimer's. In this case, we didn't see amyloid change, the protein amyloid change, but we did see evidence that memory decline was slowed, and brain shrinkage was slowed in those who responded to exercise. So we didn't hit a home run. There was a small 80-person study. We're doing 600-person studies now to try to prove these things better. But anyway, accumulating evidence that's really supporting this idea that I think a lot of people accept now, but that exercise is good for the brain. So long series of studies. I'll just say the other thing that our center does is we think a lot about metabolism, things like diabetes, things like mitochondria, and then trying to understand if we can target metabolism, will that boost brain function or brain health. And so a lot of different studies over the years and ongoing ones now really trying to understand this at a fundamental level, like is targeting metabolism a therapeutic target? Is it something that's going to help the brain? Two, things like exercise and diet, and are these things good for the brain? And then more importantly, how can we use them and leverage them to improve health? We believe this. We think prevention works. Now, when we talk about prevention, we're really thinking about delaying the onset or postponing the changes in time. Exercise and diet aren't going to erase Alzheimer's from the earth, but they do have the potential to postpone memory changes, and that across the population can have a huge impact. Postponing memory changes for 5 years can cut the incidence of Alzheimer's in half. If we can do that across the whole population. So small things can have big impact, especially at the population level. So how do we translate this to an individual? And talking to an individual, it's really, these six these pillars of brain health. Move more, increase your fitness, eat well, stay connected, sleep well, and manage your stress and your mental health. And so giving advice in these areas is important, and encouraging sort of a healthy lifestyle, a brain healthy lifestyle is important. So, how do we translate this into recommendations? Well, we say exercise more, get out and move. I'll talk a little bit more specifically about this more, but improve your diet, sleep well, and keep your brain active. Stay stimulated and stay active mentally. So with respect to exercise, I think it's probably most important to just tell people get up and get out every day, even if it's 10 minutes. And actually, that can be a good place to start. Start by doing that at 10 minutes, and then maybe you can build on it, but be consistent. Sure, our goal is more, 150 minutes of moderate intensity exercise, meaning just walking and pushing yourself a little bit, maybe get a little bit out of breath. That's moderate intensity. 30 minutes, 5 days a week is sort of a great goal, but don't get hung up on the goals, because going from zero to something is our biggest bang for the buck. So, and of course, we want people doing a little bit of strength training if they can, lifting weights, maintaining the muscle mass if they can, and flexibility and balance exercise important. But keep it simple, and try to get consistent and do it every day. What do we mean by healthy eating? This is one that's changed over time and will probably continue to change the more we learn. But a Mediterranean diet pattern, not a restrictive diet, but it's a pattern of eating, looks to have the most evidence in terms of benefits to the brain, but also to the body and to comorbidities and to morbidity. So we're seeing good data that people who are eat more of a Mediterranean diet pattern, as listed here, tend to do better over time in a lot of different ways. So eating lots of vegetables and fruits, whole grains, healthy fats, lean proteins, and limiting sugar and processed foods is a Mediterranean diet pattern. So eating this way doesn't mean restricting your diet or necessarily losing weight, but it means shifting your diet to healthy fats and less processed foods and sort of high glycemic foods, and replacing those with whole grains and healthy fats like avocado and olive oil. So that pattern is something that we push, and it's something we're studying as well. When it comes to sleep, we want good sleep duration, 7 to 9 hours, but we want high quality sleep. So as clinicians ruling out sleep apnea or REM sleep behavior disorder, periodic limb movements of sleep, and trying to treat those, melatonin, trazodone, or if people have anxiety or depression, an SSRI could potentially help with sleep. And then considering, do I need to be thinking if somebody's complaining about their memory and their mood and their sleep is poor and they snore and all that, we want to get a sleep referral and make sure we're diagnosing and treating sleep apnea. That could be the root of those symptoms. Cognitive and social activity, keep your brain active. Doesn't matter what you're doing, not really. Should they be doing brain games? Depends on if there's a lot of other stimulation in their life. But they can be a good way to go to create, some cognitive activities. So yes, There's no magic in one game over another. In fact, the data is fairly limited in terms of the long-term benefits of doing things like brain games, but we don't see carryover from the brain game into daily life yet. Meaning, if you get better at doing that game, do you get better at balancing your checkbook and driving and things like that? Haven't shown that yet. But it can't hurt you, and it's probably good long term. So doing things like crosswords if you like them, or Sudoku, or other brain games. But it's really more about how do you maintain some stimulation. Social activities can be a great way to do it. Family activities, reading, new hobbies, playing games, volunteering. So a diverse cognitive diet is the way to think about this. And so that's kind of advice we give, general advice, and it's kind of things we kind of train people in terms of through LEAP, is trying to turn those things to life in people's daily activities. So let's come back to the research a little bit, and sort of our goal is really how do we take these learnings from lifestyle and brain health and maximize their impact, and how do we get to this reality, this future hopeful goal of reducing the risk long-term of dementia incidents. And we've got to do more research. We think prevention is achievable, but we have to understand, how do we do it on an individual level? How do we scale it up to the population level? And then how do we apply it to the larger, broader population? And so we're working on these things in a lot of different ways. I'll give you a couple examples. One is, if exercise works, we're not using it very well. So how as clinicians, so how can we create tools to allow clinicians to apply it to their patients? And so we took the LEAP program and we stamped an RX on there, and we call it the LEAP RX program. This was a pragmatic trial where we basically, pitched this in the way of, in primary care, you can prescribe lifestyle medicine to your patients by clicking a button. We did have one of these best practice alerts in the system. One of the first in the system, and now we understand this is not something that physicians, and I know that now as a physician, we don't like seeing these, but it worked pretty well, where just a click of the button would refer people to this program. And the idea was we empower physicians to apply lifestyle medicine to their patients. Patients would spend a year basically getting some education and then some exercise training at a YMCA through community fitness centers. And what did we show? We showed that the people who did this do better in terms of cardiorespiratory fitness. They improve their heart and lung function, though we didn't see changes in insulin and glucose and body composition, which we were also hoping to see that. But we did see our primary outcome of cardiorespiratory fitness go up. So that paper's in press right now, should be coming out in the next few months. So exciting, but the attempt at sort of pilot initial attempt at how do we bottle these ideas up and apply them to our patients. And then one other way we're sort of pragmatically working in the system to try to scale up approaches. This is kind of a lifestyle approach, but it's blood pressure control. How do we apply what we've learned about blood pressure control and brain health to a much bigger population? And that's by creating this virtual collaborative care clinic, where we enrolled, as of yesterday, our 1,000th person, and the trial is no longer enrolling. So if you've seen this with your patients, this program, the VCCC program, you will not see it going forward until we get to version 2. But this is a pragmatic attempt, to use pharmacists and home monitoring virtually to adjust blood pressure and really aggressively control blood pressure across the population. And these are the details, but the idea here again is, we know if we control blood pressure well and aggressively, we can reduce the risk of MCI and dementia across the population. So that, how do we take that idea from an individual, at the sort of population level, and apply it to a much bigger population, so that we can harness these effects? And that's what that study is all about. So I'll kind of wrap it up now and just say this, that, in clinical practice, where are we headed with all this? And this is where we're going. And I think we're going to be there, it could be 5 years, it could be 20, but we may be there in 5 years, where we're using new blood tests to detect changes in the brain before the onset of symptoms, Alzheimer's changes, and then doing specific and proven evidence-based things to delay, halt, or reverse the disease process. This is what we're working on in a lot of different ways that I haven't talked about, but I think this day is coming and we need to prepare for it. And it's all to do this. And this is, current data actually from 2017 that shows that individuals at a certain age, their individual risk has changed over time. So in other words, if you take a 90-year-old born in 1900 compared to a 90-year-old, say today, they're at lower risk. So a 90-year-old 30 years ago was at higher risk than a 90-year-old today. So we're seeing the incidence of dementia for individuals decrease. And why is it decreasing? Well, that's a little harder to put our fingers on, but it's probably better cardiovascular health and better education around lifestyle, et cetera. And so I see this as a hopeful sign that, hey, we're already bending the curve of dementia incidence and we're just getting started. So, okay, so last couple things is if you have patients and you want to refer them for research, here's a couple ways to do it. If you're in the system, the health system, you can put in an ambulatory referral for Alzheimer's research, and we'll figure out what studies they might be eligible for. We'll take care of the details. If you got somebody interested, don't hesitate to refer them to us. Community providers, you can do the kuadrc.org/CRS. There's a lot of different ways to remember CRS there. Your patients might tell you about their CRS syndrome, but I think that means clinical referral survey or something. But CRS, or scan that code. But you can get your patients, you can refer them yourself, or you can get them to sign up. And here's probably the best way to do it, though. If your patients are asking you questions, tell them to look us up and join our My Alliance for Cognitive Health program, My Alliance program.